So good morning. I want to thank you for joining us today for today's webinar. I hope to quickly empower you with up-to-date clinical information and assist you with result interpretation. This is a brief educational webinar examining the interpretation of BioDetect results and identifying non-urine substances from Aegis Sciences Corporation. My name is Dr. Kristin Hillman, and I'm excited to be with you today. So let's go ahead and get started. So with our objectives today, we will discuss BioDetect and why an expanded validity testing has become necessary. We'll explore sample substitution and familiarize you with synthetic urine that is available to patients. There are some case studies in various treatment settings that we will work through. And lastly, we'll look at a data review of unexpected BioDetect results that was performed at Aegis. Healthcare providers rely on medication compliance test results to assist in both measuring compliance and establishing recent substance use. Providers must remain aware of specimen substitution attempts to avoid misuse and diversion going unidentified. Aegis has developed an expanded validity measure called BioDetect to assist with identification of substituted and synthetic urine specimens. Through the identification of unique markers expected in human urine, healthcare providers have a greater insight into an individual's medication adherence. Individuals may substitute a specimen to mask the use of non-prescribed substances or may spike a prescribed drug into the substituted specimen in an attempt to appear compliant with prescribed medications. This can create difficulty for providers who are utilizing routine specimen validity testing to adequately identify aberrant behaviors. Synthetic urine is one mechanism of substitution and is typically manufactured to include creatinine within normal range, appropriate pH, and other specimen validity parameters in the samples. Aegis's BioDetect test includes unique markers that are expected to be present in routinely analyzed human urine. Thus, when an authentic urine specimen is provided, it is expected that the components of the BioDetect test will be present. Without BioDetect, the risk for negative outcomes for the individual could have been missed. Synthetic urines are surprisingly widely available in smoke or head shops and online. These are just a few of the many synthetic urine products that are available online, including eBay or Amazon. The green box on the middle bottom of the slide that says sub solution is mentioned often online, and it's sold by a company called Test Negative. Online, it's touted as one of the biggest and most popular online store selling synthetic urine. Most websites are complete with directions. One explained, quote, how to use fake pee. Using a fake urine kit to pass a self-administered urine test is a straightforward process. The trick is to make sure the urine container is the same warmth as real pee. Many kits come with a heating application that you shake to provide the proper heat. So they are very equipped for people who want to purchase these items. There are stash undies, they call them. There's a stash leg strap, even a synthetic urine belt. Fake urines ran from $15 for 10 mils at Walmart to a concentrated synthetic urine. You could buy 5 gallons of it for $360. So the range is huge. Individuals in various treatment settings may rely on urine substitution as one of several different methods to adulterate or pass a urine drug test. An individual receiving treatment may be at risk for negative outcomes. We'll look at a few in the settings of pain management, opioid use and substance use disorder, and behavioral health. The results here represent an Aegis urine sample in a pain management setting that reflects non-compliance with prescribed medications. The sample has unexpected BioDetect results, noted by the result not expected, demonstrating inconsistency with routinely analyzed human urine, which informs the provider that the drug results cannot be applied to objectively assess medication compliance. This is likely a substance where the creatinine, resulting within the normal range, as you see at 76.5 milligrams per deciliter, could have been added to the specimen, perhaps in the form of purchased synthetic urine. The unexpected BioDetect results provide direction to identify diversion or substance use and determine causes of non-adherence. The opioid epidemic is particularly impactful on those requiring chronic opioid therapy to manage debilitating pain, where medication non-adherence and substance use may go unnoticed, and individuals receiving treatment may be at risk for negative outcomes. Data accumulated by the U.S. Department of Health and Human Services from 2019 showed that over 1 million individuals had an opioid use disorder in the past year, over 10 million misused prescription opioids, and over 70,000 individuals died from drug overdose. Though progress has been made over the past few years to curtail this epidemic, it has been stymied by the COVID-19 pandemic and has led to an unfortunate uptick in overdoses and hospitalizations secondary to opioid use. Growing availability of novel psychoactive substances, including designer opioids, has further complicated this issue, as use of substances of varying concentrations and strengths can significantly increase the risk for overdose, especially when taken in combination with prescription drugs. As providers navigate this landscape, identification of sample substitution or synthetic urine is of particular importance to guide their treatment decisions. This demonstrates another Aegis urine sample in a pain management setting that reflects non-compliance with prescribed medications again. However, at first glance, the methadone and the oxycodone appear compliant. However, the sample has unexpected BioDetect results, demonstrating inconsistency with routinely analyzed human urine. The creatinine again is within normal range, suggesting the possibility that this specimen could be a synthetic urine. Additionally, both oxycodone and the methadone have a no metabolites detected comment. So we would expect to see metabolites present with parent levels this elevated according to literature. Also, the specimen has a large amount of oxycodone, but it has resulted above our ability to quantitate, signified by the greater than sign. It's greater than 7,500 nanograms per mil, and without metabolites. We must question the possibility of the drug being added to whatever specimen this is. Lastly, the alprazolam appears as an unexpected negative when it's expected to be present. All the results of this lab report provide direction to identify diversion or substance use and determine causes of non-adherence. This Aegis report illustrates a urine sample collected at a substance use disorder clinic with both unexpected BioDetect results and non-compliance of prescribed buprenorphine and naloxone. It has a creatinine of 66.3 milligrams per deciliter, which is within normal limits again. The individual that substituted the sample may have substituted the specimen in an effort to mask the presence of another ingested substance. Without BioDetect, the possibility of relapse in addition to non-compliance may not have been considered, and the risk for negative outcomes may have been missed. Due to the inclusion of the BioDetect testing on this sample, the provider has additional information to guide risk stratification and to consider possible referral for additional treatment. Identification of appropriate medication use, substance misuse, and medication diversion is of particular importance and is a key to both effective care and mitigation of risk for overdose. The rate of increase in adults in the U.S. with substance use disorder is startling, as it doubled from 20.4 million people in 2019 to 40 million people in 2020. This urine sample, also collected at a substance use disorder clinic, resulted with an unexpected BioDetect result, even though the creatinine again is 89 milligrams per deciliter within normal range. The buprenorphine resulted with the comment, "Test result is higher than concentrations typically observed for this drug. Low metabolite concentration suggests possible adulteration. For additional information, please consult clinical scientists at our phone number. So because the buprenorphine is known to degrade into small amounts of its metabolite when added to a urine specimen, Aegis applies this additional comment when buprenorphine is found at a ratio of 35:1 or greater to its metabolite norbuprenorphine. This ratio has not been seen in patients that are normally ingesting the drug in the literature. The sample on this slide suggests a probable adulteration, as the ratio in this sample is well over 35:1. The Aegis results provide direction to identify diversion or substance use, so action can be taken to provide additional care or again mitigate the risk for overdose. Many individuals with mental illness fail to take their medication because of their lack of awareness of their illness or due to side effects of the prescribed therapy. The non-compliance to prescription medications represented on this Aegis urine sample, in addition to the unexpected BioDetect results, is alarming. The creatinine again is normal. Substitution of the urine sample may mask self-medication with the non-prescribed substance, diversion, or use of illicit substances, and if not recognized, could cause serious harm. Action can be taken to provide assistance to the individual that submitted the sample, and the relationship between this individual and the provider can be enhanced when the results are used to improve communication. Mental illness is becoming more prevalent as 53 million adults in the U.S. experienced a mental illness in 2020, compared to 45 million adults in 2016. That's an 8 million person increase. And there was 33% of American adults had at least one major depressive episode in 2020, compared to the only 7.8 adults in 2019. That's a 25% increase. The information offered by BioDetect allows providers to appropriately assess and to treat each specific individual in the behavioral health setting. Here's another example in the mental health setting with non-compliance to prescription medications. And there's an unexpected BioDetect result. And as you see, this one also has an invalid creatinine. This is likely substitution with something other than synthetic urine because the creatinine is invalid, and it is just as alarming. It is so important to identify possible diversion or substance use with Aegis reports in order to provide effective care for every patient. Aegis reviewed data for over 836,000 urine samples collected from February of 2021 to March of 2022. There were just under 5,000 samples reporting with unexpected BioDetect results. That's 0.6%. This chart demonstrates the frequency of prescribed medication by class in samples with unexpected BioDetect results. As you can see, the classes with the greatest frequency are those that are most often prescribed in pain management, behavioral health, and mental health settings. The illustration on this slide categorizes the same data set by the percent of urine specimens with unexpected BioDetect results by state. The total number of specimens with unexpected BioDetect results is just under 5,000 specimens, which again is 0.6%. States with overall low sample volume were excluded. As you can see, Kansas and Iowa are the two states where there was 1.4% of the specimens that were found to have unexpected BioDetect results. This was followed by New York, Georgia, then Florida, and then down the next grouping would be Tennessee, Arkansas, and Louisiana. So as you can see, this definitely is helpful for our physicians and definitely needs to be a part of our practice. So these are the references for my talk today. And before we wrap up, I just want to tell you how to get in touch with us for additional clinical support. The individuals pictured on your screen are my colleagues, the clinical pharmacists at Aegis Sciences. We are ready and willing to take your calls and emails regarding today's content or any other questions you may have about result interpretation or drug testing in general. The information covered today is also available in written form, accessible online at aegislabs.com. And you just go to resources, then clinical update. Thank you so much for joining me today, and I hope you have a wonderful day.